Gram for gram, cheddar cheese actually contains more tryptophan than turkey does. Hi, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician. My mission is to make videos that answer your urgent medical questions, and boy have I been getting a lot of varied medical questions across all of my social media platforms. That's why today I'm going to mix things up with some rapid-fire answers to some of your burning medical questions. But before I do, if you haven't already done so, make sure that you hit the subscribe button and turn your bell notifications on. That way you are the first to know when I post new videos. Okay, brace yourselves, here we go. No lengthy discussions on one medical topic here. Today I'm going to answer some of your most pressing medical questions. Speaking of burning question, can you get sexually transmitted disease if you're on birth control? Well, this might seem obvious for some, but the answer is yes. You can get an STD while on birth control. Birth control is only used to prevent against getting pregnant and regulating your menstrual cycle. You can still get many types of STDs such as HIV, gonorrhea, chlamydia, syphilis, and many more. Outside of abstinence, the only way to protect against STDs is by using protection such as a condom. Next question. Can you suck the poison out of a snake bite? No, you cannot. If you're bitten by what you believe to be a venomous snake, please immediately go to the closest emergency department. Do not try any maneuvers that you've seen in the movies or religious snake charming. For some cases, the only remedy for a venomous snake bite is the antivenom, which is usually only carried in hospitals. Here's another one. I have bad allergies. Do allergy shots work? And how do they work? Yes, allergy shots work over a period of time. They work by injecting a small amount of what you are allergic to, likely into your shoulder, and slowly over time your body changes the specific way it reacts to the allergen, and you will not have the same type of reaction that you are currently having. The histamine that is released in your body is what causes your allergic reaction that you see. But when you change the reaction with allergy shots or microdosing, histamine is not released anymore. This is why we give medications that we call antihistamines when you're having an allergy or an allergic reaction. Can doctors do whole body scans for everything? Not typically. Outside of the radiation exposure, which I've discussed in my previous video, and if you haven't seen it, please see the link below. When you do a full body scan, there's a potential that the scan could pick up something very benign that then falsely leads a patient down a rabbit hole of a ton of different tests, where often they do more harm than good for your body. If you have specific concerns that need addressing, please talk to your healthcare provider and they can order specific tests or images that might be right for your ailment. What is a silent heart attack? A silent heart attack is when you're not having any pain or symptoms such as chest pain, shortness of breath, nausea, vomiting, arm pain, or neck pain, but the doctor states that you've had a heart attack. Silent heart attacks are typically found by an EKG, which shows that there has been previous injury to your heart. When this happens, the best thing to do is to prevent any future injuries from happening with lifestyle changes, diet changes, exercise, and developing very good relationships with your primary care doctor and cardiologist. Next question. Why do I snore? Is snoring dangerous? Snoring is a sound you make when your airway is getting closed off. It can be dangerous as typically people snore due to anatomical abnormalities or excess tissue in the throat or the back of the mouth, as well as being overweight. Typically, the tongue falls backwards in your mouth when you fall asleep, causing you to cut off your own airway, causing snoring. Typically, this is a sign of somebody having sleep apnea, to which they do not get a restful night of sleep and are always feeling tired and fatigued. If this is a case for you, please get checked out by your primary care doctor for a possible sleep study. The nose breathing strips attempt to open up the nasal passages and might help, but typically snoring and sleep apnea are in the back of the nose and the back of the throat, which are causing the problem. Is it true that turkey makes you sleepy because of the tryptophan? The often repeated turkey myth stems from the fact that turkey contains the amino acid tryptophan, which forms the basis of chemicals in the brain that make people feel tired. But turkey isn't any more sleep-inducing than other foods. In fact, consuming large amounts of carbohydrates and alcohol may be the real cause of the post-Thanksgiving meal snooze. Tryptophan is a component of the brain chemical serotonin, which gets converted into the well-known sleep-producing hormone melatonin. Poultry and other foods also contain tryptophan in similar amounts that are found in turkey. Gram for gram, cheddar cheese actually contains more tryptophan than turkey does. Basically, any big meal containing tryptophan and lots of carbohydrates can trigger sleepiness, not just turkey. And on Thanksgiving, many other factors contribute to the feelings of tiredness, such as drinking alcohol. Because the weather is cold out, am I more susceptible to getting sick? No, although many people associate cold weather with the common cold. While the weather is not directly responsible for making people feel sick, the viruses that cause colds may spread more easily in lower temperatures, and exposure to cold and dry air may adversely impact the body's own immune system. Do I need to stay awake after I've had a concussion? Most of the time the answer is no. As long as the patient is holding a conversation and acting normally, they can go to sleep. If there is continued neurologic symptoms such as dizziness, abnormal gait, vomiting, abnormal behavior, then they should be checked out in the emergency department. It is good practice if a patient has not seen a doctor and had a concussion that someone checked on them periodically throughout the night. Can chewing gum stay in my stomach for 7 years? This is false. Though, that being said, your stomach cannot break down a piece of gum the same way it breaks down other foods, as we typically cannot break down the resin that it contains. So instead of just sitting there and rotting for 7 years like some old wives' tale suggests, instead the digestive system can move it along intact throughout the normal intestinal activity. In other words, it comes out the other end whole or as a solid piece of gum. What is a hiccup? A hiccup is an unwanted muscle contraction of your diaphragm. Hiccups may result from a large meal, alcoholic or carbonated beverages, or sudden excitement. In some cases, hiccups might be a sign of an underlying medical condition. For most people, a bout of hiccups usually lasts a few minutes. Rarely do hiccups last or persist for months. Many home remedies for hiccup treatments are helpful in stopping hiccups. There are medications in the emergency department that can be given if all other options have been exhausted. Why do I get the Asian flush? Alcohol flush reaction can often also be known as Asian flush syndrome, Asian flush reaction, or the Asian glow. It's a condition in which the person develops flushes or blotches associated with redness on the face, neck, shoulders, or in some cases, the entire body after consuming alcoholic beverages. The reaction is a result of the accumulation of acetaldehyde, a metabolic byproduct of the catabolic metabolism of alcohol, and is caused by an acetyl dehydrogenase 2 deficiency. Approximately 30 to 50% of East Asians, Chinese, Japanese, or Koreans, get this reaction. There's no specific treatment for this syndrome. Some people skirt around the issue by taking antihistamines or over-the-counter drugs to stop themselves from having reaction turning their skin red. Even if such self-prescribed drug cocktails work, they only mask the effects and do not treat the cause. This is even more dangerous because it lulls drinkers into a false sense of security while the acetaldehyde continues to linger in their blood. Can I just take more of my medication if it's not working? In a majority of the cases, more of your medication is not better. Adjustments of the doses of your medications should be done by your physician or healthcare provider. Many increases in dosages of medications will typically cause more harm than good to different organs in your body. Specific examples of this is over-the-counter medications such as Tylenol or ibuprofen. Taking more of the recommended dose will not significantly increase their effects, but will increase their harm to your liver and kidneys. So just don't do it. Can you use the stove for heat when it's cold out? No, please do not do that. Doing this can increase the possibility of carbon monoxide poisoning. Carbon monoxide poisoning occurs when carbon monoxide, a colorless, odorless, tasteless gas produced by burning gasoline, wood, propane, charcoal, or other fuel, builds up in your bloodstream. When you have too much carbon monoxide in the air, your body replaces the oxygen in the red blood cells with carbon monoxide. This can lead to serious tissue damage or even death. Is gluten bad for humans? Gluten is a protein found in many grains including wheat, barley, and rye. It's common in foods such as pizza, bread, pasta, and cereal. Gluten provides no essential nutrients. People with celiac disease avoid sickness and maintain much better health if they follow a gluten-free diet. For them, a gluten-free diet is nothing short of essential. Avoiding gluten makes sense for people with celiac disease, wheat allergy, or those who feel unwell when they consume gluten. However, there is no compelling evidence that gluten-free diets improve health or prevent disease if you do not have celiac disease and can eat gluten without trouble. Of course, future research can change this theory in the future. I often hear the term fractured a bone. How does that differ from breaking a bone? Fracture and broken mean exactly the same thing. The terms are interchangeable. Fracture is broken and broken is fracture. All right, that's been your 5 minutes of rapid fire question and answer sesh with me, Dr. Wagner. I hope I cleared up some questions you may have had. If you have a pressing medical question as well, make sure you leave me a comment below and let me know what it is. And make sure that you subscribe and turn your bell notifications on. Also, please hit the like button. That way I can continue to make medical videos just like these. Thank you so much for watching and stay healthy, my friends.